Stem cell therapy. Introduction to stem cells. Stem cells are the special type of human cells which have the ability to develop or to differentiate into various type of cells in human body. Stem cells are the precursor cells which can give rise to a variety of tissues such as muscle cells, sex cells, fat cells, immune cells, bone cells, epithelial cells, nervous cells, and blood cells. Thus, they act as building blocks of all multicellular organisms. Special features of stem cells. Stem cells have self-renewal capacity to proliferate without any loss of differentiation potential and without undergoing any senescence. Stem cells act as repair system of the body and can replace the damaged, dying, and old cells. Stem cells are uncommitted cells until they receive specific signals to develop into specialized cells. Stem cells have plasticity, that is, stem cell from one tissue can give rise to cell type of different tissue. Example, plasticity of hematopoietic stem cells to form heart muscles. Types of stem cells. Stem cells are divided into two categories based on differential potency and based on origin. Based on potency. Based on potency, stem cells are divided into the following: totipotent, pluripotent, multipotent, oligopotent, and unipotent stem cells. Let us see each one of them in detail. Totipotent stem cells. Totipotent cells can differentiate into any possible type of cell, including embryonic tissues. Pluripotent stem cells. The cells from early embryo are pluripotent and can differentiate into any type of cell, including three-layered germ cells. Multipotent stem cells. Multipotent stem cells can divide into only related type of cells like hematopoietic cells dividing into blood cells. Oligopotent stem cells. Oligopotent stem cells can differentiate into only few types of cells such as lymphoid and myeloid cells. Unipotent stem cells. Unipotent stem cells can only differentiate into its own types, but they can still renew themselves like our epithelial cells. Based on origin. Based on origin, stem cells are divided into embryonic stem cells, fetal stem cells, perinatal stem cells, adult stem cells, and induced pluripotent stem cells. Embryonic stem cells. Embryonic stem cells are the cells derived from the embryos at the blastocyst stage, and they are pluripotent, which has the capacity to differentiate into any type of cell, including the three germ layers, endoderm, ectoderm, and mesoderm. They have two distinctive properties. One is pluripotency and the other is the ability to replicate indefinitely. These properties allow them to be used in regeneration or in repairing diseased tissues and organs. Fetal stem cells. Fetal stem cells are located in the organs of fetuses. Under this category, there are neural crest cells, fetal hematopoietic stem cells, and fetal mesenchymal stem cells. Perinatal stem cells. Perinatal stem cells are derived from perinatal tissues such as umbilical cord, amniotic fluid, and placental tissues. Adult stem cells. Adult stem cells are also known as somatic stem cells, which can renew itself and can differentiate into specialized cell types of the tissues and organs. They are multipotent cells with primary role of maintaining and repairing the tissues. They include hematopoietic stem cells, mesenchymal stem cells, hepatic cells, pancreatic cells, epithelial cells, etc. Induced pluripotent stem cells. In 2006, Dr. Shinya Yamanaka collected adult somatic cells which have been genetically reprogrammed with transcription factors called Yamanaka factors to embryonic stem cells called induced pluripotent stem cells. These cells can regain the capacity to differentiate into any type of cell. Let us have a look at what is stem cell therapy. Stem cell therapy is a regenerative method. It is the technique used to treat the damaged or diseased tissues with the help of stem cells to replace or repair the damaged tissues. The ability of stem cells to self-renew offers significant potential for generation of tissues that can replace diseased and damaged areas in the body with minimal risk of rejection and no side effects. History of stem cell research and stem cell therapy. In 1956, the first bone marrow transplant was successfully transplanted. In 1968, the first successful bone marrow transplant was used in the treatment of SCID. In 1970s, bone marrow transplant was successfully used in treating leukemia and immunodeficiency diseases. In 1981, first embryonic stem cells were isolated from mouse blastocysts. In 1988, first hematopoietic stem cells from adult mice were purified and characterized. In 1997, Dolly the sheep was produced by Ian Wilmot in Edinburgh. In 1998, first human embryonic stem cells were isolated. In 2001, mouse embryonic stem cells were created using nuclear transfer. In 2002, pancreatic stem cells were derived from mouse embryonic stem cells to cure diabetes in mice successfully. In 2004, by using human embryonic stem cells, Parkinson's disease was treated with stem cell therapy. In 2005, human embryonic stem cells were found to differentiate into active functioning nerve cells when placed in mouse brains. In 2005, pancreatic cells were derived from adult stem cells. In 2006, first embryonic stem cells were derived from the morula of a mouse. In 2006, embryonic stem cells were first grown without animal tissues or cells in the culture. In 2010, with human stem cells, a person with spinal injury was treated successfully for the first time. In 2012, promising treatment of blindness with human embryonic stem cell was discovered. In 2013, first human embryonic stem cells were produced from the fetal cells using therapeutic cloning. Stem cell therapy is termed as regenerative method because of the generative functions of stem cells. Anti-inflammatory. Inflammations like pain, heat, redness, swelling, and loss of functions will not be caused by stem cells. Immunomodulations. Affected immune system can be cured by differentiation of stem cells into macrophages, neutrophils, B cells, T cells, and dendritic cells. Differentiation. Stem cells know how to specialize and differentiate into any type of cell. Homing. Stem cells know where and how to migrate to the target sites efficiently. Transplanted hematopoietic stem cells will migrate to the target niche by responding to the gradients of chemoattractants. Revascularization. Stem cell will effectively increase the flow of blood in blood vessels. Stem cells can maximize cell longevity with efficient removal and processing of dead cells. Uses of stem cells. Stem cell therapy can be used in low vitality or energy, osteoarthritis, autoimmune diseases like rheumatoid arthritis, congestive heart failure, type 2 diabetes, kidney disease, multiple sclerosis, Crohn's disease, early stages of Alzheimer's, nagging or chronic aches or pain in joints, neurological issues, chronic fatigue, hair regeneration for men and women, gum regeneration, cartilage regeneration like orthopedics and wound healing. Methodology of stem cell therapy. Methodology includes the following process. isolation of stem cells, disaggregation of the stem cells, culturing of the cells, cryopreservation if needed, differentiation into desired types, transplantation of the cells to replace or repair the damaged cells, monitoring of the cells after treatment. Isolation. Isolation of required stem cells from donor is done. Disaggregation. Separation of cultured stem cells is done with the help of centrifuge. Culturing. Culturing of the collected stem cells in laboratory for required amount of time. Cryopreservation. Required cultured stem cells are cryopreserved in liquid nitrogen as long as needed. Differentiation. When there is need of therapy, these stem cells are processed to differentiate into desired type of cells. Transplantation. The differentiated stem cells are allowed to transplant at our desired area of treatment to replace the diseased or damaged tissues with the help of injections. Monitoring. Monitoring of the replaced cells is made at regular intervals. Stem cell therapy in Parkinson's diseases. Parkinson's disease is a chronic, degenerative neurological disorder that affects the body's motor system. It is caused by the lack of dopamine made by brain cells. Patients with Parkinson's disease will have symptoms like depression, sleeping disorders, weight loss, blepharospasm, orthostatic hypertension, difficulty in speaking, swallowing, and respiratory issues, and tremor, which is the main symptom of this disease. The treatment involves the use of stem cells to restore normal production of dopamine. Adult stem cells are collected from the patient, often from skin or blood, and are genetically reprogrammed with transcription factors to induce pluripotent stem cells. These reprogrammed stem cells will behave like embryonic stem cells, which in turn differentiate into dopamine-producing brain cells. When these reprogrammed iPS cells are transplanted into the brains of the patients, they will be producing normal amount of dopamine. Thus, Parkinson's disease can be cured. Stem cell therapy in Alzheimer's diseases. Alzheimer's disease, a progressive neurodegenerative illness, is the most common form of dementia. Patients with Alzheimer's disease will have symptoms like memory loss, confusion with time or place, problem solving, trouble in speaking or writing, trouble with familiar tasks, and changes in mood and personality. This disease can be treated by stem cell therapy. Treatment includes collection and culturing of epithelial stem cells, induced pluripotent stem cells, or mesenchymal stem cells from donor. These stem cells are then transplanted into patients, which will increase the neuronal differentiation, reduction in beta deposits, microglia activation, and increased ACH levels. This will block Alzheimer's diseases in patients. Another treatment includes the collection of bone marrow stem cells from the donor and transplanting them into deceased patient. These stem cells will be acting as a replacement for defective neural cells in brain, which will block Alzheimer's diseases. Stem cell therapy in leukemia. Leukemia is the cancer in blood caused by the increase in number of white blood cells like lymphocytes, monocytes, neutrophils, eosinophils, and basophils in our body. This abnormal amount of leukocytes in blood will lead to abnormality in immunity. Leukemia can be treated by stem cell therapy with isolation of bone marrow stem cells and are transplanted back into the patient. These stem cells will then act as progenitor stem cells and differentiate into blood cells, which prevent leukemia. Stem cell therapy in heart diseases. Adult stem cells are used in the treatment of several cardiac diseases like congestive heart failure, coronary artery diseases, and cardiomyopathy by means of stem cell therapies. Treatment of heart diseases can be done with isolation of HSC, blood cells, and muscle cells, which are cultured in laboratory for required amount of time. These stem cells are then transplanted into patient heart muscles, which will differentiate into vascular cells, increase neovascularization, inhibit apoptosis, and inhibit hypertrophy, which in turn prevents several heart diseases. Stem cell therapy in diabetics. Mesenchymal stem cells are isolated from donor and are cultured. These stem cells are now transplanted into diabetic patients, which in turn replace the defective beta cells with direct differentiation, increase endogenous regeneration, and abrogating the autoimmune responses to new beta cells. This leads to the generation of normal pancreatic beta cells, which will effectively produce normal level of insulin and prevents diabetics. Thus, dependence on injecting or taking insulin is eliminated by this stem cell therapy. Recent advancements in stem cell therapy. In eye diseases, recent studies confirm that induced pluripotent stem cells can differentiate into photoreceptors like cone cells and rod cells, which can replace defective neurons and prevent blindness. In stroke, stem cells are collected and injected into distant arteries or veins of the patient, which travels to the site of the stroke in the brain to fuel the repair process. The optimal time for introducing the stem cell is between 36 and 72 hours after the stroke. New blood cell formation. Researchers led by Dr. Joe Mountford, University of Glasgow, resulted in generation of red blood cells from stem cells to make a limitless supply of clean blood for transfusion. This blood can be helpful for those who lose blood through surgery or injury. In tissue repair, recent studies confirm that stem cells can regenerate into skin tissues, spinal cord, and heart tissues in laboratory, which can be used in several disease treatments. Disorders in nervous system. The stem cells are collected from the patient's bone marrow and then implanted back after processing. These stem cells can repair the damaged tissue or to reactivate existing cells so it can recover the functions of the injured nervous system as much as possible. In treating baldness, hair follicles contain stem cells called dermal papilla. Stem cells from hair follicles are collected and cultured and implanted back again in the scalp of the patient. Thus, new hair cells are developed and baldness can be treated with stem cell therapy. Organ regeneration with stem cells. Several studies demonstrated that it is possible to grow an entire organ to replace the damaged or diseased ones. By means of decellularization and recellularization of scaffolds using stem cells, an entire bioartificial organ can be developed. By creating a scaffold with biodegradable polymers and seeding them with embryonic stem cells or adult stem cells, an entire organ can be shaped and developed with specific growth factors. This scaffold is then implanted into the patients and the stem cells generate into specific tissues, leading to regeneration of scaffold and formation of a complete organ. Advantages of stem cell therapy. There are several advantages in stem cell therapy, like reverse inflammation, immune system regulation, re-establishment of cell-to-cell communication, replacement of damaged cells, regeneration of normal blood flow, etc. There is no risk of rejection or no communicable disease transmission. General anesthesia is not necessary, fast recovery, and gives powerful results. Disadvantages of stem cell therapy. There are few disadvantages in stem cell therapy, such as extraction of bone marrow causes severe pain. Only fewer amounts of tissues and cells can be obtained. The proliferative and differentiation capacity of stem cells declines with aging. The inhomogeneous cell population potentially can transfer infections and disorders when the cells are not monitored properly. Stem cells are one-time sources, and universal donors are not available. Conclusion. Some people are against stem cell researches and also have several ethical issues about the research community causing harm or even death to cells, tissues, and embryo. They believe embryos have same amount of importance and ethics like human adults, and once the embryo is fertilized, they deserve respect and care. Apart from these controversies, stem cells have been used to treat many diseases and disorders so far because of their regeneration capacity. Thus, stem cell researchers and stem cell therapy will be a promising way of finding cure and treatment for a number of diseases and disorders in the future. Thank you.